Highlights to changing and wording will be covered, so that we can have a good set of information heading into the next meeting, which is scheduled to be the consensus vote. Exciting. All right, I think it's almost, yeah, we're almost there. Again, if you can put your name in the chat, even though some of you are well known, it helps. And one of the things that we're going to be thinking about how to capture is that usually HL7 meetings, you can see who was there, like there's like an attendance. And we're so lucky to have so many critical voices be part of this meeting. So we are trying to figure out how to like register who was at our meetings, because there's so many of you brilliant people from so many critical agencies and perspectives. So for right now, Mark Savage, you are from many things. It's true. So funny. Okay, here we go. Ready to go. Next slide. Welcome to the Gravity Public Call. This is, again, we're smaller than we used to do. I think eventually we need to change the large number. Everyone's muted upon entry. Please know that we ask you to stay muted just to avoid background noise, but we do always have a robust conversation here. So just let us know if there's something you want to have be part of the conversation, and we'll try to include it. And then the call is being recorded, as you know. The recordings are available on the Confluence, as are the slides. Please send all chats to everyone so that we can include them in the conversation everybody can see. Next slide. This is the common antitrust practices slide. So Gravity Project participants have the responsibility to comply fully with federal and state antitrust laws. And just in general, individuals speaking or providing written communications shall refrain from any discussion which may provide the basis for an inference that they have agreed to take any action related to prices, services, production, and allocation of markets or any other matter having a market effect. And I will not read the whole thing because we read it most times, but just know this is the guidelines by which we navigate professionally in this space. Next slide. Our agenda is to welcome you, which we're doing right now, and then 'tis the season for new code releases. So part of what we do at Gravity is build terminology together here about concepts, build the concepts that we want to represent in terminology and to gather existing terminology. We do that in our domain-focused work. That's what we're doing right now into utility and security. As everyone knows, then we go, the terminology team then goes offline for a little bit, and we work on those submissions to coding stewards. Then when those codes are released into the ecosystem, we then integrate them into our value sets, right? So there's this public work, which is domain-focused. And then there's the ongoing maintenance, which is the curation and maintenance and integration of all of those value sets that are in BSAC. So Homali is going to lead us in that, actually sometimes called the Duchess of Value Sets, the amazing, meticulous lead of that work. And then we have, we're going into our end-to-end review on utility and security that includes some prior domain concepts that need to be, or that we're suggesting get added to Gravity value sets, but they still need to be vetted as part of our public process. And then the utility and security end-to-end review, which is largely new definitions that we're missing, and some definition changes, lots of changes, but changes that are not as bold, significant in quantity, but we're hoping that you all will come along with us. And there's a couple things that are to be determined that we still need to iron out with SMEs. And then we'll close with community homework and next steps. Hi, Andy. Nice to see you. Next slide. Next slide. We are still there's still opportunity to comment on the IC10CM submission for digital literacy. We will look very closely with many experts in the ecosystem on those submissions. And we have a process for submitting comments. It's all in the Confluence. We do invite you always to our Gravity technical meetings, Wednesdays from 1 to 2 Eastern Standard Time, and then the monthly Pilot Affinity meetings. The last Thursday of every month. And again, we are grateful for our friends at Civitas Networks for Health for supporting the pilot implementation workstream. I believe our next topic in the Pilot Affinity Group for May is on opportunities, existing capacity and opportunities for documenting outcomes. Because outcomes are such a critical part of evaluating the effectiveness of our interventions. So we're going to be talking about that at the Affinity Group in May. Next slide. These are our core use cases. Next slide. Actually, I'm going to go back 1 second. I'm so sorry. I just realized as we're talking about outcomes, an opportunity is, of course, that third use case, right? There's both individual level outcomes, like was this, referral complete? Did the severity of food insecurity decrease? Was this task completed? And then there's also community level and population level outcomes, which are really critical for those structural interventions. And so we'll be talking about that when we convene in May in the Affinity Group. Opportunities there. Next slide. All right, next slide. Super excited again, our roadmap is that we're doing coding for food, those HICPIC codes with our friends at in the food as medicine leadership space in the fall, addressing the domains of language barriers and legal history of legal involvement and history of incarceration. We are gathering our subject matter experts for the latter 2 domains of reference. We have, so if those of you have, and again, to be a subject matter expert in a domain, it really is helpful to have an understanding regarding the comprehensive elements of the domain, including how it's measured and its significance and all of the psychometric elements of it. So it's kind of a very, like right now, our SMEs are experts in all of those things. They're experts in documenting the dimensions of domains and creating instruments to measure those domains and understanding the interventions that we do to address those domains. So if you have ideas about SMEs that we can look into for language barriers and legal incarceration, just send us an email at gravityproject@hl7.org. We are reaching out to our federal friends for SMEs there too, because we always do that as well.
Sarah,
Hi, yes.
could you just say a sentence or two about the concept language barriers?
Yeah.
Which languages and what are barriers?
Yeah, so this is a great thing to talk about because right now, if you think about standards to address language, you think about concepts such as preferred language or interpreter needed, right? Those current standards for addressing language needs in clinical and social care settings are insufficient to document the multilingual nature of many residents, because just because you have a preferred language doesn't mean you're not capable of speaking in English. It also doesn't sufficiently represent needs for different types of access devices, such as translation services or adaptability services for those who are both deaf and blind, right? So all of that capacity of communication is insufficiently represented in the 2 concepts we have right now that are part of standards. So Gravity is going to be leaning into it as we lean into everything to understand all of the dimensions of communication in health and social care and ensure that we gather the instruments and concepts and interventions that we need to gather in order to address that realm well.
That's terrific. Could you consider adding the notion of trust, even if
Yep.
you speak perfect English and
Yes.
think that you know a lot?
Yes.
Doesn't mean that you're going to trust anything that any provider says.
Yeah,
So
we're really looking forward to addressing, yes, 100%. That sounds like a great idea. We look
thank you.
forward, yeah. But just know that it's driven by a very careful analysis of how insufficient the current standards are to address the complexity and nuances of communication. And we hope
I
to,
think there's literature about trust as a barrier, as a language. I don't know how it's formulated, but the necessity for trust and communication. There is literature on that subject, so subject matter expert about it hopefully
Sounds
can
great.
be identified. Thanks.
So if you have an idea of a subject matter expert or an idea of a reference paper that you want us to look into, if you can just send us an email at gravityproject@hl7.org and then either put like their LinkedIn name or their, if they're working in academia, they should have an academic web page because we do a lot of research. We look at all their papers and we try to understand whether, so if you can send us in an email as much information as possible, that'd be great. And state level reps, yes, we love them too. Right. So it's actually really important to have people who are directly connected to interventions sometimes, and the closer you are to the sometimes state level is where that's at. So please, any and all ideas welcome. And again, if you can send us as much information about the person that you're suggesting, or if you wanted to send a research paper, just let us know. We're happy to receive it. Program taxonomy, the classification of existing gravity programs is the way I'm trying to reframe that, just so it's very clear the scope there. That should be kicking off shortly, and we'll talk about how that gets integrated into this public call at the next meeting. It's too early to state that at this time, but I look forward to coming back to you on the 16th with that. We are working through updates to the IG. Looking forward to connect-a-thons. Definitely, we always try to focus on the CMS one because it is free. And then we did talk about the affinity group. Whew. Okay. We're still awaiting the new use case to come out of our two discoveries, but note that the affinity presentation on outcomes is related to that discovery because we want to first make sure that everyone understands what we already can do, and then we will be able to document what needs to be updated and added to our existing profile. Next slide. Whew. Any questions on the roadmap? Excited to think about the fall. Okay, next slide. Next slide. I believe I'm passing the mic now to Hamali, who's going to walk us through the updates and the releases. Next slide.
Thanks, Sarah.
Go for it.
Yeah, thank you. So Sarah has recapped the process that we all go through almost for 4 months in the public build, and then we take it off 2 more months of work with standard development organizations, including Insecurity, US International, participants from AHIMA and AHA for ICD-10. We work closely with Region Strip for inclusion of any screener identified to get it included into Region Strip Low-Inc. And although it is a very tedious process and a long process, we really look forward for the result that we see towards the end of it, I guess. And as a terminologist, I always tell Sarah, I want to show the end result. I want to show the actual terminology. I want to, vouch for it, because all the hard work that we do is really for getting to this point so that we can have those codes available in the SDOs and make it available for the ecosystem through value set update. So this is a quick recap of also we mainly focus on 3 standards: SINOMED City, Low-Inc, and ICD-10-CM. Low-Inc is released twice a year, February and August. SINOMED US is released twice a year, which is March and September, and ICD-10, I think it's April and October. And as we have those releases coming in, we make sure that we go into the release file and look into all the codes that we have submitted through Gravity process, find the new codes and gather them locally so that we can then go back and update the value sets, which are then released twice a year, one time at the end of the June and another is at the end of the December. So for March 2024 US release, and some of the codes are in SINOMED International as well, which is released every month, are around 64 codes that those are submitted by Gravity. And this slide lists the domains for which those codes are submitted and an overview of the count on how many codes has been released into Cinemed City. You can see that Elder Abuse has done, I think, almost a year in 2022, but it usually takes time for that code to be worked on and included in Cinemed City, and now it is released and ready for us to get included into VSAC. So this is just a quick recap of how many codes are released in March 2024 and related international releases. So the next slide is just a recap of what domains, which code, and we have also listed if it's a diagnosis code, it's a code, is it a situation, is it a procedure, and whether it is released as a Cinemed US or Cinemed International. So if we identify a code which is applicable to 2 or more countries, I guess 2 or 3 more countries, then that gets moved from US submission to international submission, so other countries can also use it. So we have a mix of Cinemed US and international. So the next slide is just enumeration of all the codes that we have released for multiple S2H domain. You can see that certain codes are specific to that domain, but there are certain codes which are applicable to multiple S2H domain, which we then include into the general S2H value set that gets applied to all the domains. And here is, I think, the last slide for the remaining domains. So now that these codes are available, and once we are towards the end of the utility insecurity, when we go to the next month, that is mainly the maintenance work month for us. We go into the VSAC and then update all those value sets with these codes, and on June 30th, we make those released for public to download and use in their data sets, EHRs, or any way that they can exchange data between their organizations. So this is a quick recap of the end product of all the hard work that we do with all of your support. Sarah, anything to add?
Well, Lucy has a question. She has a very sweet statement, impressed, and she said, fair to say sans gravity, none of these codes would exist, or would they have appeared anyway? And I replied that they generally would likely not exist. That's why gravity was created, was to fill the significant gap in very basic concepts to address social needs. But I do want to note that we do have friends in the ecosystem, such as the VA, who do submit terminology to SNOMED as well. The good thing is we work directly with the VA on almost all of the terminology that they needed when we did the veteran status domain. But I do want to note that when it comes to developing terminology in this space, the VA is another voice that we know is out there.
And I think I was trying to answer that at the same time in the chat, Sarah. So I think that, there would be sporadic pop-ups of these concepts as certain, organizations need one. But I think this systematic approach certainly wouldn't exist, and certainly not this breadth of codes. Absolutely.
Yes. And
you can see, actually, aligned with what I was saying, those concepts of the veteran status were directly crafted with the VA for their programs, to represent their programs in SNOMED CT, right? So even if that's a good example of although they are leaders in terminology, we work together to make those terms.
And just to recap, till date, I think Gravity has submitted over 1,000 codes in SNOMED City, so that is really something that we really cherish about.
Himali, thank you. Amazing. And again, so this is the maintenance of what we do, right? There's new domain work, and then there is the significant maintenance of the many value sets we have in VSAC and the integration of newly released terms. And if not for the meticulous curation and like documentation of the terminology team, notably Himali and Sarah Bahal, it would not be possible. So thank you, amazing humans.
Thanks, Sarah. Awesome.
Yeah, it's amazing. All right. Okay, so we're about to head into end-to-end review, our second and final end-to-end review cycle before we head into the consensus vote on the 16th. Next slide. Here we are, May 2nd. And our final end-to-end review, we're going to remind ourselves what that is, and then we look forward to coming together for the consensus vote on the 16th. I just want to again applaud the work of the terminology team and the subject matter experts and all of you all to get us to this place. The amount of documentation and labor in this process is significant. So thank you all for helping us get there. And, thanks for the patience of the terminology team as they keep track of all the elements there. So we're going to, again, end-to-end review has a very specific purpose. We're going to talk about that in the next slides. Next slide. The point of end-to-end review is are there things missing? And I say, the point is just to ask. Terminology is doing that asking. The SMEs are doing that asking, and you all are doing that asking. Like, we ourselves sit back and we say, is this necessary? Right? We've been doing a lot of that this week. Like, is this needed? And then we're like, yes, no, right? Is this missing? And then sometimes you can't see it's missing until you see it on a slide. Like, we just had some concepts come up that Dr. Hernandez raised were missing. And so we're going to be working on filling those gaps. And then are there incorrect concepts that need to be changed, like change in the word? And you'll see that we did this a bit with so there was consistency across our program types, like the concept of arrears versus arrearage, or a correct name for one of the new housing concepts, like tribal designated housing, tribally designated housing entity, right? We were missing the housing concept there. So, and then there's a lot of incorrects, which are really just like edits, which are definitions that we've fixed and simplified or refined that we're just changing. And then there's this missing. Is it unnecessary? If so, then we thoroughly examine it. We don't want to be creating terms that are not helpful. So we always try to ask ourselves if it's necessary. And we ask you all to help us do this. If when you're looking at the master and you feel like things meet any of those concepts, something's missing, something can be fixed, something is unnecessary and should be removed, please do so formally. Again, this is a formal process, has to be sent an email with rationale and evidence for suggested alternate approaches, because every single thing in the master has a reference, highly evidence-based, because we need those when we go to build terminology, right? We can't build it without evidence. So send those emails to gravityproject807.org, and then we address them with our subject matter experts. And send them as quick as you can. And then we did give a deadline for the comments, I believe. Sarah Bahal, can you remind me, is it on the next slide? Or was it on the previous one? I'm trying to remember. Let me think. So this is where you access the master list. I just want to make sure that everyone understands that we did have I know, thank you so much, Lucy. I know we do, and the great thing is people are even asking us to, generally what I can say is we're aware of concepts across the social care ecosystem, because by now, SNOMED, ICD, and our friends at Registry actually send us things that are submitted by others to see if they integrate, right? We just had this happen just a few minutes ago from CDC. Right, so they want to make sure that it integrates to our process, and that we are, that we vet it with our subject matter experts. So we recognize that respect, and we promise to uphold it. So I just want to make sure, Sarah B, I asked that question regarding the deadline for end-to-end review comments. I didn't see it on the previous slide, or was it there? I don't think it was. I think you said this the 14th. Is that what you said? No, when was the date?
I think the date should be May 9th for incorporation and
right.
review of their SMEs before the community call.
Yeah, so again, I was trying to build a rationale. I'm like, I knew there was a deadline, and I'm sorry, because I was actually on vacation last week, so I'm just like going back. Please send any interim review comments by the 9th, because it takes a while to change things, right? There's lots of meticulous curation. So if we go back to the next slide, the emails with the rationale and evidence regarding these 3 areas, missing, incorrect, and unnecessary, need to be sent to us by May 9th, so that we have time to integrate that into the final master for the consensus vote. So it's not on the slide, but please note that, May 9th, and we'll send it in the email. But that's important. Okay, next slide. And then here again, this is where you find the master list, 5 p.m. PST tomorrow. Next slide. This is also where we find a lot of evidence. Again, like many of the papers of our subject matter experts are there. Next slide. So this is the Samantha Morton led revisions. Again, she's not on the call today, but she'll be here next week regarding the ACF aligned definitions for medical legal partnership and legal aid. Again, we didn't have a national definition, and then because of the Medical Legal Partnership Plus program through ACF, we now do. So we're referencing that. This is not new. Next slide. There are some updates and I mentioned this in my end-to-end review comment as a possibility, right? So we updated and corrected the name of the tribally designated housing entity, because even though they're called colloquially a tribally designated entity, their full name in legislation is the tribally designated housing entity, or TDHE. And then we have aligned definitions for public housing agency and tribally designated housing agency now. So that was to be determined, and it's now solidified, and you'll find that in the master. Again, the tribally designated housing entity is the correct name for the tribal entity that manages federal HUD funds to deliver housing programs. And again, this is all also in line with what you can see is investigating the way funds are distributed from national from federal to other entities within utility and security has had us ensure that we're analyzing whether states, tribal entities, and territories are correctly represented, because there's this trifecta of ways that the funds are disseminated from feds into states, tribes, and territories. And so we wanted to make sure that our program aligned with that truth. Next slide. Again, these are not new. We presented these last time. There's no edits to this slide. These are the new calendar year 24 HCPC codes for Medicare physician fee schedule. We've talked about these in the affinity call. If you want, it was not April, but March. Next slide. Okay, next slide. Here we're going into end-to-end review. I'm just going to give another thank you to our amazing subject matter experts who, because I was away last week, met us today during lunch to make sure that everything was good for the public call today. We could not do without these three amazing leaders and experts, Dr. Diana Hernandez, Dr. Debbie Frank, and Dr. Stephanie Edner de Cuba. We could not do without them. Their literature is all across our utility and security page in the Confluence, and they are just brilliant. And we've had the best time. They are so fun. So thank you all for helping. Diana and Stephanie are here with us today, I believe. I did not think Debbie could be here, but thanks again. And next slide. Again, this is at the consideration of those dimensions that we think about when we think about measurement and diagnoses: worry, stability, quantity, quality, and cultural acceptability. Next slide. All right. Next slide. There's no updates here, which is great. Screening assessments. We can just kind of click through this because it's all good. We're still working on the validity grade conversation, Lucy. That's a work in progress, along with some, community education we're doing on concepts of assessments and how to categorize them. So coming soon to a call near you. No updates here. This has been stable for some time. And again, thanks for all of your help in getting us here. Next slide. And again, this is just repeated that slide because those instruments all measure one of these dimensions in some way, or measure all of them depending on how thorough they are. Next slide. And then we had our supplemental questions, which, although they will not be available as assessment instruments for the domain of reference, because they don't tell you whether you're energy insecure, utility insecure, or water insecure, we will work on creating an implementation resource or reference to document how critical those elements are. Next slide. And this is the example from Diana's research in New York. Next slide. And then we had the Los Angeles example as well. And there are other municipal examples out there, right? So what I found was at least 4 other municipal entities that had similar documentation of do not dependency on medical devices. I want to, energy dependent medical and adaptive devices. I want to note as well that we've found the same thing when it comes to water as well. So water dependent medical or medical devices, mostly not adaptive devices. Next slide. Next slide. Okay, updates in red text. And apologize to anybody who's colorblind. We try to make it noticeable, but not, but realize that we have some color issues. And so sometimes the change is simple as this a letter that we missed. You can see that there. Next slide. And again, all of this is on the master. And then we did some pretty significant wording and rewording across all of our definitions, but it's all the same, right? So because Monique was very sweet, we were talking about what happens when you get 4 terminologists in a room, is that you really nuance and think about words and how they go together and what order they should be in. So we changed the order. So there was a logical order in utility companies to state, to territory, and tribal. And then we adjusted, we did not feel that the customers needing special assistance actually was a sufficient pairing to the income eligibility. And so we clarified that there's 2 pathways to eligibility. One is income and those with other specific eligibility criteria, not just those needing special assistance, because that was a vague. And what we know from our research, and you all saw that from the previous slides on the medical adaptive devices, is there is age criteria. There are, over 65 or younger than 3. There are condition criteria. There's device criteria. There are all kinds of criteria. So we have other specific eligibility criteria to cover it. And that because it's a utility program, it's and or. And then that pattern carries across all of the other programs, right? So you see, we did do a wording change because adding connection to PS. Oh, yes. There's a wording change because we felt like monetary pledge was awkward. That's not entirely new. And then what we did is we realized that we did not have, oh, sorry. Hi, Janice. Hi.
Hi, I just want to add one other thing with utility and security.
Yeah.
Maybe it's only with broadband, but where people might have to pay a monthly fee to have it maintained.
Yeah.
Yeah.
Yes. So we have that and add-on fees as well, right?
Okay, good.
Yeah. Yeah, and we'll examine whether, again, part of what we do is sit back and we say, do we have all of the elements included? You'll see that very clearly in the energy company programs. And what we did, you can see we consolidated the activation fee and reinstatement fee because there's actually many different types of fees depending on whether you're a renter or a homeowner, depending on you have to reconnect after disconnection or if it's your first time and you're a renter. So we were just building one concept. We realized the 2 wasn't enough and the many was too many. So for right now, we're just building a utility connection fee assistance program.
And this is energy primarily energy, right?
This is utility. No, it's right. Again, the precedent is this is utility, generally water and energy. And then we go into energy and then we go into water and the same precedent, the same pattern applies. It's very nerdy.
Yeah, also I want to say that in our utility discount program in King County, Washington, it covers for people that have condominiums, it covers sewer and others. So it's all included.
You'll see, Janice, that we had to update our water concepts to include wastewater. So
right.
Yeah, that's coming soon. And that relates to something.
And garbage, it's actually ours incorporates all 3. So
wow.
Anyway, yeah.
Yeah, and this wastewater one addresses something that Lucy raised on an early call. So,
Yeah.
all right, so we have the precedent and the definitions, you'll note that, and then we consolidated the connection concept, and then you'll see these precedents is repeated. This is the precedent that gets repeated across future slides. Next slide. And then again, this is just simplifying. Again, we are terminologists, so we try to make the definition actually make sense. So utility shut-off protection program, we just revised the definition to be a little bit more straightforward. And then we have our 2 subtypes right now, and we're actually working on a third, right? Because we ourselves with the SMEs, our SME Diana, one of this today, raised the idea that there actually is a different shut-off protection specifically for energy that she knows, which is due to weather, inability to shut off energy due to either hot weather, cold weather, or extreme weather. So we're working on filling that gap. And then my job was to figure out whether there was similar areas for water, and I found this. So this is what we have right now, and then you might see, again, just from the analyzing to see what's missing, a couple shut-off protection additions, especially in the energy program area, maybe not in the greater utility one. Next slide.
Sarah,
Yeah.
Sarah, before you leave, before you leave this one, is timeliness important enough for utility shut-off protection to be in the definition program to assist to prevent utility shut-off timely and so forth? Or is that just too vague or never comes up?
Well, let's talk about. I'll talk about it with the SMEs tomorrow, or they're here. That's it. I hear you. That's a. I mean, I think this is what we do this for. If you want to, I don't think you have to submit that one formally.
Okay.
We'll talk about. I think that's something that we'll consider tomorrow when we meet. We convene after the call. Okay.
Okay.
I like it. Next slide. Okay, and then this is just to enter into the extensive ACF Administration of Children and Families, Office of Community Services, Division of Energy Services, Utility and Security Programs. Whew. Notably, LIHEAP and LIWAP. Next slide. We have no changes to most of these. The only thing that happened is that we had changed the LIWAP Energy Assistance Referral Hotline because we did it by literally calling it because we didn't know the name of it. So we called. We called the hotline, and they told us the hotline because there was just a general name on the ACF, OCF, LIHEAP. So it's called the National Energy Assistance Referral Hotline. And so that is the correct name. And just want to note for all of the LIHEAP programs, you're going to see a subtle shift in definitions because you can see in the top box for LIHEAP, we had 2 definition sources. Exactly. Yes, exactly, Janice, near. We had one from ACF, which was a little clunky. And then we had the benefits.gov one. So benefits.gov is really great, kind of, almost plain language, much more approachable definitions through their benefits clearinghouse and benefits definition resource. And so we're going with that one because it's just very straightforward. And that is becoming the precedent for, and we were weighing back and forth with these for a while. That's going to become the precedent you'll see across all of the LIHEAP and LIWAP programs, right? So the LIHEAP definition for benefits.gov just gets slightly edited in each instance to talk about specific heating assistance, cooling assistance, crisis assistance, weatherization assistance programs. There's a specific new reference for NEAR, and then on the next slide, this is end-to-end review is nerdy. It's like literally final project, like going through your dissertation, making sure all the I's are dotted and T's are crossed. These are general, again, we have utility assistance, and then we have general energy assistance, then we have subtypes. Yes, Janice?
Yeah, I don't know if you just heard that Oregon's using their waiver 115 for, I think it's the 115 waiver for people that need air conditioners and yeah.
New York is doing the same thing, right? And it's like, yeah, this is something that we have talked a lot about.
It's super important.
Yeah.
But there's a lot of negative feedback. People are saying there's people on Medicaid. We need to put people on Medicaid, but that's up to each state to do, not, whatever.
Yeah, so we definitely have talked about, and I think Debbie's not here. But she sends us emails, and then we also know that's happening in New York as well, right? The equipment that you need, it's both in New York policy. We know that because we look at the references, but we also know this from working with New York as a pilot with their waiver, not a pilot, assisting New York with the design and implementation of their waiver is something that Gravity's doing within the implementation work stream.
And in Oregon, they, some of the pushback is sort of like, this is pretty cush, but they're addressing the elderly and the people that end up in the hot,
It might die.
yeah,
Like
it's
this,
targeted for the group that's most impacted health-wise by it, right?
yeah, and Diana actually Diana's outside today during this call. She's on the call, but if you look at some of the references and papers in Diana's that are authored by Diana on the Confluence, she discusses that, the house too cold, house too hot problem, definitely within her research in New York and nationally. We talked a lot about Texas, in our calls. Yeah. There's a lot about, and you can see that equipment like that is included in the Medicaid and CHIP, health-related social needs services coverage Medicaid table that was released in the fall, along with the White House SDOH framework, right? So everyone agrees that this is an important thing, especially unfortunately, within a climate change world. So this is we talked about utility assistance. This is the energy assistance programs, again, high level. It's the same pattern. So the pattern is the pattern. We just had to offer definitions. Again, we try to make specific programs that are possible, but also we make, better words, what we call the easy button. But the logic is all there. There's a new concept that didn't have a definition before. The concept was presented, and that's energy literacy program. We will add to the Confluence. I don't think I did this yet, and my apologies again. I'm definitely segueing back. The Department of Energy has a very, very clear energy literacy program framework with objectives and criteria, and that is the reference of note for this concept. And that is publicly available. We'll make sure it's on the Confluence. But what we realized, I think it was like about 3 weeks ago, is that this is often an intervention that is used to make the efforts of LIHEAP programs go further, and also a general intervention to improve efficiency and energy use and energy consumption and energy sustainability. So luckily DOE had a framework and we just followed it. And it should be on the Confluence soon. Again, I might give the team time until Monday because it's been a busy week. All right, next slide. I want to make sure I'm not missing anything in the chat. Okay, great. And then now we go into the specific subtypes. We talked about the general energy assistance programs and needing to have those because maybe you don't know the specific subtype you're referring somebody to. But when you do know, when you're a community health worker or you're US Aging or you're, some entity that knows exactly what you want to refer somebody to, like the community health workers in my FQHC know exactly the program they want to send the person to. So these are the programs to meet that need, and they again are all follow the same framework. Right now, we only have the highest level tribal energy assistance program concept. Note that we can easily fill in additional concepts, but this is the one we found the strongest level of evidence for. Energy programs are operationalized differently a bit in tribal entities, and we are committed to making sure that if there are updates to be added, they can be added again. They can just plug in. But right now, at least we're filling in the gap with the tribal energy assistance program concepts. So you have state programs, tribal programs, and then you have the energy company programs. And again, this is all driven by this amazing, the work of our subject matter experts and the Administration of Children and Families LIHEAP Clearinghouse, which is this massive list of every single state and how they operationalize all of these programs down from LIHEAP to state programs, to energy programs, to charitable programs. All right, next slide. And then these are the shutoff protection programs. Again, this is what I mentioned, like we ourselves note absences. And this is where we noticed that we had age criteria and medical certification, but we did not have due to weather. So we are going to be leaning into filling that gap. Again, LIHEAP Clearinghouse they have a disconnection page that talks about all of the different disconnection strategies by state and like the regulations and legislations that support them. And so we have a reference already. We're just going to build the concept and we're going to loop back around tomorrow. And again, this was hot off the press today at lunch. Diana, thank you. Absence noted when we saw it missing on the slide. No change to community solar subscription program. But again, those three concepts that weather related criteria will address are when it is too hot to shut off, too cold to shut off, which are seasonal, or if there is a disaster, like an energy extreme weather event. Those are all related capacities and criteria for shut off for not being able to disconnect your energy supply. Next slide. And that's all related to safety, Janice. We were just talking about air conditioners, right? So if it's August in Dallas, right, you have different rules applying for shutting off someone's power because of the requirement for air conditioning to sustain lives. Next slide. This one just got edited a little bit. The definition, we just realized we were too overly dependent on only federal funding. So we just had to expand it to offer federal, state, territorial, tribal, charitable organizations. And again, the precedent for the pattern is the same. No big changes in the pattern there. Next slide. LIWAP has not changed. Again, this is based off the benefits.gov precedent. Next slide. And except for the fact, if we go back, I don't know if we highlighted this, but I did mention it, wastewater, right? So I think it's somewhere in our tracking, but the addition of wastewater, the amazing terminology team caught that it wasn't in the definition, even though it was referenced on the page, and so that's there now. And wastewater and water programs across municipal entities, or they're always coupled. So that is there now in the definition, and it's just it's an update. Next slide. All right, so now we have those water service assistance program and all the subtypes, right? Again, you can see the precedents the same, right? We have the general water service assistance program. We have the deposit, arrears, and fee assistance program. Again, those add-on fees. And then the pattern is the same pattern. So this is definitely end-to-end review. We're like tweaking, refining, and those concepts, again, you can see replicated across previous energy and water concepts.
And Sarah, we added municipal for all.
Yes, yeah, because of so thank you so much. You're helpful. We added municipal because many programs are administered at the municipal level. And there is, we have solar programs represented a little bit. Janice, and luckily Diana is really keen on this. We did talk about the BMC solar prescription program, but we'll just make sure that we're not missing other solar efficiency programs in our audit. If you have a reference, please let us know.
Well, because I do know Hawaii and I expect probably California too have provided assistance. Some states have banned it. A lot of states adopted it. And then in some southern states, they stopped it because I don't know, whatever, because they were too efficient or something. And yeah, I mean, the community was installing it and it was a win-win. But in California, they've got too much solar power right now. It's a problem. So what
we
to
do
do?
have, we do have community solar subscriptions. I do want to note that part of the nuance and interesting thing regarding the tribal energy assistance programs is there's a lot of solar use there. So what we'll do is just bring that up with the SMEs tomorrow and just make sure that we don't have a gap when we look at the program types. Sound good?
Sounds great. Yeah, I don't know I just know people that have used it.
Yeah.
Right? And when we have it accessible too, or in King County. So I think it's pretty widespread.
Yeah, so I'll look for, I will, if Washington and Hawaii are seed states, we can definitely look into that. Lucy?
Yeah, I hope I can articulate this, but I heard a program recently about Flint. Flint has been trying to replace all that terrible lead piping from a century ago. And they had people on the program saying, whatever they're doing, I don't trust it. I'm still buying water and
Yeah.
using bottles of water for all my water needs.
Yeah.
If you encounter a patient who says that, is that meaningful for your SDOH assessment, or is that just an interesting observation?
That is, it's like one of those, we see that actually in a lot of, we see trust as a barrier to participation in programs across all of our domains, right?
Mm,
We see it whether it comes to engaging even in Medicaid or food stamps, if you're a undocumented immigrant, or if you are worried about DCF engagement. So I think trust is always relevant.
So
And
maybe as we talk about outcomes, we could
yeah,
remember that
yeah,
trust intervenes
yeah,
despite everybody's best efforts
yeah.
to promote or create or enable a positive outcome.
Yeah, like what is in the declination, right? So we have one of the things that we're leaning into as an opportunity within outcomes documentation is an ACT capacity statement, because capacity assessments of community-based organizations is really critical, and we use that. I mean, we talk about capacity in healthcare all the time, especially within mental behavioral health. So I love that idea. Maybe not specifically just here, but definitely for the outcomes conversation. Matt?
Great.
I was speaking to an advocate for homeless people experiencing homelessness, and he was saying that their local Department of Social Service in New York in Ithaca told him that for eligibility determination that local social service departments had discretion under the law, some kind of like evaluator's discretion to determine eligibility. So with respect, first of all, do you know if that's true? And so with respect to the question of trust, there was the feeling from some of the participants in these programs like SNAP that it's kind of it's somewhat arbitrary, or that if you like don't bring the right attitude to the person that you're applying for or what have you, that they're gonna, reject your application without real cause. Do you know if it's true that there is discretion and
So I would, okay, so this is what I can say, understanding that I have limitations. The specific criteria, and if Elena's on the call, she's such a good eligibility person, but there are some programs that have discretionary evaluation for triaging and acuity assessment, and there's some that don't, right?
Right.
So all housing programs, all continuity of care housing programs are required by HUD, again, all based on what we've heard, based on our HMIS friends, based on National Alliance to End Homelessness, right? There's this VISDAT, right? So there's for community action agencies by regulation in many states, and for housing agencies mandated by HUD through the continuity of care organizations, they have to assess acuity, right? So assessing acuity is by nature discretionary, right? It's not just XYZ, it's XYZ plus, 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 right? And so that assessment of primacy is partly done to address limited supply, right? So if you have limited housing placements, if you have limited next steps, then you assess, and this is partly what came out of our community, our social care voice co-design project, right? Is that we were missing this concept of assessing acuity. And we know that by regulation, our community action agencies are mandated to do the social risk matrix. We collated all of these assessments. And we know that HUD, even though HUD is changing it, is required to do the VISDAT, which is a horrible acronym, but I have copies of it, right? That I think is in flux. They are changing again. They're changing that requirement because there's been a lot of like bias judgment on the VISDAT. Like people are like, that is not a good instrument because of X, Y, and Z. It leaves out these people. So the moment you're talking bias, And the moment you're talking acuity assessment, that is an element of discretion in my mind. I think that's probably what they were saying, maybe? Does that make sense?
Yeah, but that shouldn't exist for a program like SNAP then.
It
Like,
shouldn't exist for a program like SNAP.
Right.
This is Janice. A bigger problem with SNAP, I know, because I know a lot of people. I work with individuals, around homelessness in my county. And I mean, I'm on committees with them, so they're friends. And is that they can fill out all the forms. It is a hassle. And then they might only get $12 a month. So
Yeah.
the matrix she just talked about is very bizarre. So you might make less money than somebody else, but because of the plus, somebody else might get more money. Like I applied one time just because I couldn't believe this friend of mine could get it. And I ended up getting the full amount. And I don't get it now, and so you don't ever know, right?
Right.
And it's individuals. It's just like you get on a bus and somebody's not a very nice bus driver or a very nice stewardess. It can be a bad day and your SNAP worker could be having a bad day. I mean, that's all. And it could, yeah.
There's a really good comment from Beth on, again, that's a really good point. The only examples I gave are the examples that I know, right? There are compliance issues. The built-in capacity for discretion is in the subtlety of the application of those triaging instruments in my mind, right?
Yeah, totally.
Again, but let's hold that because it's not directly related. I just want to hold it over here. And I think that is one of the use cases we're trying to explore as we look at how to operationalize the things that came out of the code design. If that's okay. Are we good to keep on moving? Just for the sake of, okay. All nuance being noted. And I'm happy to drop the VISDAT and social risk maintenance matrix into the chat for anyone who wants it. Again, the social risk matrix was mandated by Texas community action agencies. Every single community action agency in Texas has to complete the social risk matrix on all of their incoming clients before they direct them to services. Okay, next slide. And then we are analyzing currently whether we need different criteria, whether there's a weather criteria here. Haven't found anything. I will send this to you, Denise, if I can find it. I have the copy that they sent me as part of the co-design work, the Texas Community Action Agency reps. Next slide. Okay, I think this is the end. Next slide. I think this is the end of our interventions. So those are all the updates on missing definitions and possibly missing programs within our interventions framework or refined interventions. We're now going to quickly go into diagnoses and goals in our last half hour. Again, end-to-end review is the I-dotting, T-crossing, meticulous final project effort before we go into the consensus vote next week. Oh, in 2 weeks. Sorry, no, I don't want to give terminology. 2 weeks. We have 2 weeks. All right, next slide. All right, so this is on diagnoses. Next slide. We've talked about this before. Next slide. Some edits here because we realized even though our subtypes in children of utility insecurity, energy insecurity, and water insecurity were very clearly regarding access to services, these parents were not. And so we're going to be working on difficulties. I don't think the difficulties is a good word. None of us think difficulties is a good word. We agree on this. But this little addendum about it being related to the service is important. And so we're going to be figuring out if you have any ideas regarding a better word than difficulties, but it's like due to energy and or water service blank, due to energy service difficulties, and then due to water service difficulties. We needed those final comments on these long, stable definitions in order to clearly state what was in and out of the domain, because it was too massive before. And you'll see the barriers. Sure, that's a good idea. We'll put a
Yes,
We're talking about
challenges. I mean, I know so welcome to being a terminologist. Kamali, Monique, Sarah, and I just sit there. We're like, what is the word? So we'll figure out. But no, I don't think that word choice is going to significantly change the concept. So I feel comfortable heading into the vote in 2 weeks. And you might by then terminology might have picked a best word. But if you have any other ideas, just let us know. And you'll see that we don't have to do this except for in one in the next concepts. Next slide. All right, so lots of red here because again, we are finally applying the precedent. It's always we took the precedent of the previous slides and we apply it to all of the children. So we have the parent concepts for utility insecurity, energy insecurity, and water insecurity, and then we apply it to all of them. Completely nerdy. And the reason why we do this is because this kind of pattern and the references for it are required when we build our submissions into SNOMED. We have to have like reasons why we did everything. And so if we repeat our processes and our wording, then it's easier to defend. So you can see that what we have, we didn't need to add due to service difficulties because those qualifiers ground it. Utility service disconnect notice, disconnected, financial resources. That's the one that has the difficulties first, and we're trying to figure out whether it's needed there. Difficulty paying for utility services, and then we have disconnect notice and disconnected, right? So that takes we again the pattern for these we presented at the last meeting. We just hadn't applied it to every single one of the concepts. We've done this now. It's incredibly detailed work. It's like sewing, it's like embroidery. You can see it's quite solid. There might be, again, some concepts that get removed because they're extraneous, because again, we're trying to be frugal and only put words there that we need, but the precedent is you all agreed to it earlier, and we just applied it across these concepts. We also did, I think the order on these concepts I think has been stable for a little bit, the order of the things in the parenthetical. Maybe it's new, it's all red, so it's hard to know. We did do some work in considering the order after adequate and the order after energy needs and the order after water needs to make sure that it all was a logical flow. And we talked about our sources for that the last time we met. For water, it's the HWISE instrument. And then for energy needs, it's the literature of our subject matter experts and ACF OCS. All right, next slide. And again, these precedents could just get continued. And then across energy insecurity and water insecurity, we had late breaking ideas on how to address the work in progress bit, but we need to represent the intersection when inadequate housing weatherization and inadequate housing equipment drive energy insecurity, like when you don't have working wiring in your house, or when you live in a house, in a poorly insulated home environment and it's driving up your energy costs. This concept is already almost obsolete because in our 12-to-1 with our subject matter experts, they helped us ground it. Again, Diana, Stephanie, thank you. And so we do have thoughts of a path forward, but the concept will stay. The wording will change, but this idea of energy insecurity driven by inadequate housing weatherization and inadequate housing equipment are the concepts we need to represent. And again, those are all very detailed, very carefully in the literature of Dr. Hernandez and Children's Health Watch, and ACF and the feds. And they're very specifically detailed also in tools like the ACF housing insecurity scale. We just need to lean into those. And I think what we came up with at noon is going to be helpful.
Sarah,
Yeah.
Inadequate is unconstitutionally vague, and
I know.
it really helped me to turn to the revised definitions where adequate is, from our point of view, evoking safe, stable, affordable, and sustainable. So
That's why I think the
if we're,
qualifiers
we're
will help.
cross-referencing what's inadequate versus what's adequate, you've already specified what's adequate, and therefore inadequate can be any of these four possibilities, and maybe others.
Well, except for the fact that for inadequate housing, the definition was slightly different. We've already addressed inadequate housing and have it defined. It's that housing that doesn't meet habitability standards. There's a whole, so it's like we're knitting together two
Oh,
concepts.
okay, sorry.
No, no sorries, but I do feel like the weatherization element will help, right? So by adding what we can imagine this becoming is energy insecurity due to inadequate housing weatherization. Right? And so the weatherization is a clear way of describing why the housing is inadequate, right? Or energy insecurity due to inadequate housing, energy equipment, right? And so noted, unfortunately, we can't directly follow the precedent for adequate because inadequate housing was an existing concept before gravity and is a HUD concept, so we couldn't change it. We already defined it in 2021 or 2. But we'll try to make sure it's as clear as possible before we head into the vote. But everything you just said is, we hear you. This welcome to the waters we waded in. Other than that, Lucy, I'm so grateful for you. Other than that, you can see we changed the plural medications because we realized it could just be one medication. So we had to take off the S and then change the change require to requires. So these are the kinds of nitty-gritty details that we work through an end-to-end review. Next slide. Again, this is applying the precedent, right? So we established the precedent for our definitions, and this is just applying it. So no great updates here. And again, with those concepts we were talking about, Janice and Lucy, this keeps residents uncomfortably hot and uncomfortably cold. Those also relate to some of the concepts we were talking about earlier in heat and cold burden and experiences and interventions aligning with waivers. Next slide. And then these are just, it's kind of a what was there before concept. So this is the part of what we do. There's a lot of gaps we're filling, right? But there's also some concepts that already were there from previous domain work or because of other work in the ecosystem. So there already was the concept for unable to obtain electricity in residents due to limited financial resources. That was a gravity concept from our material hardship work. Living in housing without electricity is an existing concept in SNOMED. It obviously applies to energy insecurity. It's not comprehensive because electricity is only one facet of energy. We know that now because we've done this domain, but it's a thing. It applies, and so we're noting it. Lucy, this is where these inadequate housing concepts come back to haunt us, right? So inadequate housing, environmental temperature, and inadequate housing utilities are existing concepts in IC10 CM. They were not raised by gravity. We are thinking we might have to advocate for them to be refined because they do not fully represent the concept of utility and security. But they are here and they apply, they just don't address it fully enough. And so this is when we gather our IC10CM wizards and try to figure out a path forward. We will try to do that. Yeah, so inadequate housing was a concept long-standing in IC10CM. It's even international, I think, I'm pretty sure. And then HUD uses it throughout its research as part of its American Housing Survey work and housing quality and housing status. Okay. I think next slide. This again is applying this is water now. Whew, we've done a lot of work, friends. This is true final end-to-end review. Again, I just want to give another shout out to the amazing team that meticulously reviews all of these concepts to get them to you. Sarah Bahal, Molly Sagewall, and Monique Van Berkem. I'm a minor role in this. It's amazing. All of the review that happens and all the meticulous documentation and changes and all the sequelae. So thanks for being amazing, super terminology friends. So you can see that the water service concepts just mimic the same precedent. No great changes here. Next slide. These are the water concepts that existed prior, right? So of note, we don't have the water, the Z59.12 concept here, but it would apply because the inclusion terms under inadequate housing utilities is quite broad. But we do have unable to obtain water in residents due to limited financial resources. That was a material hardship concept. And lack of running water in house is an existing STEM UT concept, and so that's there. All right, next slide. All right, and so these are our goals, right? And so there are some new goals, because one of the things that we entertain is when we think about the different activities, diagnoses, goals, and interventions, we know we have to be meticulous in documenting problems. It has to be a this and not a that, but the goal statements can be a little looser, a little fluffier, right? And so there's some concepts here: adequate heating in residence, adequate cooling in residence, and that are new, and then able to afford water service in residence is a concept that's new that just relates, and it doesn't have an existing code. But adequate heating and adequate cooling in residence were already there, and we are proposing that they are appropriate for goals in our value sets, aligning with energy and security. Again, the goal statements are used for the aspirational path forward when you have a problem. So we're not just completely deficit-based, and we're looking toward future solutions. Another place that can be used, and Matt raised this on a different call, is that we've all long known that our goal concepts are able to be protective factors for a different person in a different situation, or the same person at a different time. We do have analyzing all of our protective factor statement, all of our goal statements, and building further protective factor statements as part of our future domain work. That was driven and spearheaded by our friends in the intimate partner violence expertise work, who know how critical that is, especially in working in situations of elder abuse and IPV. So that coming soon to a domain build near you. Next slide. All right, I think it is 5:14. This is the final project to end all final projects, right? We just presented to you all of the updates since we last met. There was a few areas where even the terminology in SMEs recognized absences. What you can expect is that we're going to be looking for expanded shutoff criteria for energy, at least, because we have to build that weatherization, the weather criteria, because we only have age and medical certification. You know that we're going to be leaning into the intersection of inadequate housing and energy insecurity, and I even kind of gave you a sneak peek of what we'd have. We did not have the heart to put it on the slides, because everything that goes on the slides has to go into the master, and that's a lot of work. So there's a pens down moment in terminology to allow all of the work that has to happen to get the master ready for you tomorrow. And our pens down moment was earlier, and so those energy insecurity, inadequate housing concepts are coming. If you in your end-to-end review, you have until the 9th of May to send any updates. Next slide. Any other questions? I's dotting, T's crossing. Next slide. All right, I think your homework's here. So please submit concepts by the 9th, so we have time to work them with our subject matter experts. You already know some of the things that will be different when we look at the master list for vote prior to the vote. Our next meeting is the consensus vote on the 16th. In that meeting, we'll also be talking about summer plans and fall plans. A little bit too early to talk about them now, but right now, that is what we're heading into. So send in your comments by the 9th. Again, here's the president. We are so grateful for all of you. Thank you so much. And if there's no other final thoughts, thank you for our May 2nd final end-to-end review meeting. Join us at our other calls. The next implementation workstream meetings after the next public call here, so we'll see you there. It looks like, oh, thank you, Beth. That's really nice addendum. I don't see anything else new. Any other comments before we sign off?
Oh, somebody else sent Kate.
Okay. Thank you, friends. Thank you, Terminology team, for your amazing work. Thank you, SMEs, for the lunch huddle. Thank you, community, for all of your insight. And we look forward to seeing you in 2 weeks.
Thank you, Sarah.
Happy birthday.
Happy birthday, Sarah. Happy birthday.
That was yesterday. Thank you.
Happy birthday.
Mine was the 30th.
I know. Beltane. My mother elected to have me born on Beltane International Labor Day, and for a
Oh
reason.
my goodness.
And look what happened. I know. Bye.
Bye.
Bye.